Hello and welcome back to another episode of the Healthy Habits for Active Aging podcast. We are your hosts, Dr. Michael Gorman
and Dr. Lauren Bennett.
And I can't believe today is podcast number 18. And today we're going to be talking about something called platelet rich plasma. Now, this is a topic we briefly discussed in last week's podcast with Dr. Manish Suthar. He talked briefly about PRP. So today we're just going to expand on that.
Sure. Lately, we've been talking a lot about chronic pain, cortisone injections, and conservative treatments. So we did want to elaborate. We had somebody question a couple other conservative treatments besides surgery. So today we want to go over the PRP, platelet rich plasma. Who would be a good candidate? What is it for? What are the pros, cons, and risks?
And before we go further, let's remind our audience that not only can they check us out on Spotify and Apple Podcasts and Google Podcasts, now we are going, not live, but you're going to see us on YouTube. So go to the iMove PT YouTube channel and you can laugh at us. You can throw tomatoes at the screen, whatever you want to do, but we're going to be there as well.
You get to see our goofy faces weekly.
Joy of joy.
Okay. So the past couple of weeks, like we said, please refer back to podcast 16, 17, where you can tune into what is a cortisone injection and also Dr. Manish Suthar's interview over conservative treatment. But today we will focus on the PRP, the platelet rich plasma.
Yeah, we just like to make sure everyone understands, we're not giving you medical advice. We're merely trying to share some information, some options out there. Ultimately, of course, it's up to you as far as what path you want to go down, but we're just here to present some options.
Yes, definitely. So PRP, what is it? It is a regenerative medicine. Essentially, it allows your body to use its natural growth factors to heal itself. So they'll take a vial of blood, put it in this big machine called a centrifuge, mix it up. And so when you mix it up, it kind of splits up the platelets, red blood cells, plasma, white cells, and they take that plasma and essentially inject it back into the area that is inflamed. So that way your body can use its natural growth factors to heal itself.
Do you know when PRP started? I'm going to quiz you. And you know what? You can say anything you want because I do not know the answer. But
you know what? In writing this, I did not come across that. But I'm going to say it's been around for probably at least 10 years because I think it was around when I was starting school.
Yeah, I might say 20 years. I think
20 years?
I feel like maybe around 2000 or so. Maybe we'll give our guest from last week, Dr. Suthar, a call. He would probably know for sure.
He would probably know. So now that we know what it is and what its purpose is, Dr. Gorman, if you want to elaborate on some areas of the body that you've seen it used on.
Absolutely. So it can be used on torn tendons. It can be used on inflamed tendons, muscle injury, arthritis related pain, and then any joint injuries. That's where I've seen it. And I've seen it in so many different joints. There's not too many joints I can think of I haven't, but I would say primarily for sure knees. I've seen it in hips. I've seen it in the spine. So really a wide variety of joints.
Yeah, definitely. I would agree on that. I would say for me, the most I've seen is probably rotator cuff tear. People have a partially torn rotator cuff, but they're trying to avoid surgery. So some research out there has showed some successful PRP injections that gets right to that site and can actually regrow tissue. And then if you combine that with physical therapy, you can actually, while that tissue is regrowing, strengthen the cuff, the scapular muscles around it, and achieve normal function again.
Yeah, I think that's good. I'm sure we're going to probably talk about this, but I don't feel like PRP or cortisone injections or anything should be a standalone only, because the truth of the matter is when you have pain, and let's face it, you're not going to spend money on getting a PRP injection unless you're having some pain. When you have pain, your body loses its physical function in the area. It loses range of motion. It loses strength. And just because you get the PRP or the cortisone injections or a whole host of things they inject now, it doesn't mean that poof, your problem's going to go away. They all help with healing, but that's why we tell you guys to combine it with skilled one-on-one physical therapy where we are trying to we're not trying to cure the problem, but we're trying to help the problem, trying to help heal it faster than if you just had the cortisone or the PRP.
That is a very good point as well. And when I was researching for this, I also came across that some doctors, if the patient is able to, can use PRP even with surgery for accelerated healing rates, which I don't know if I've ever seen that clinically, but it is an option that is out there. And again, like Dr. Gorman said, we're just trying to present information so that way, if a doctor doesn't discuss something with you, you know that it exists, and then you can ask if you are a good candidate for that.
For sure. So let's talk about, as Dr. Bennett said, I have seen it before where they will inject the patient's own the PRP. They do the platelet rich plasma when they're having surgery. So I would be curious. I know you said there's not a study out there, but I'd be real curious to see how a patient recovers after surgery if they do the PRP in the surgical site compared to now. But anyway, we're kind of getting off topic here, but but it can also be used for other things. We've seen it used for Achilles tendon pain, patellar tendonitis, and then the really dreaded, and if you've ever had this, you know that it's a beast, is plantar fasciitis. It even sounds terrible.
I know.
We could have come up with a better word than plantar fasciitis, but anyway. So
yeah, I think that in the clinic, rotator cuff, tennis elbow, I have definitely seen a good number of PRP and tennis elbow. But please, I cannot stress enough, physical therapy combined with PRP, specifically, especially tennis elbow. If you are an athlete, you have got to get the right skilled training to strengthen those muscles and not just rely on that injection to completely strengthen it, because there's a reason why it became inflamed in the first place.
Sure. And what do you think, your experience, how many PRP injections will a person typically have? I know it varies, but what have you seen?
It definitely varies. I would say in the clinic, I've seen 1 to 2. I haven't seen any more than 2, but I do know that more than 1 is required sometimes, which is actually one of the drawbacks of the PRP, because insurance does not typically cover it. You would have to check your own plan, but they can be a little expensive. So when people get the first injection and say it doesn't work to its fullest ability, and then they're told that they need a second injection on top of that, that can be like a drawback for that.
Well, I have a great idea. One day we're going to do a podcast on insurance and list all the things that your insurance that you pay so dearly for does not cover. But anyway, I'll step off that soapbox. Okay, it's time for us to take a commercial break. Our sponsor is iMove PT, and they are a mobile physical therapy practice. So please enjoy learning about iMove PT, and we will be back with you in about 35 seconds. All right, we are back. Thank you, iMove PT, for being our sponsor each and every week. We appreciate you, and we're going to come right back, and we're going to now talk about the pros and cons. There's pros and cons of everything in life. I tell my kids this all the time. So let's talk about pros and cons. So Dr. Bennett, go ahead. Let's get started with this.
Sure. So the pros are that it helps with the inflammatory process. So essentially, you could be taking less oral anti-inflammatories, decrease use of opioids, and then you're essentially using your body's own blood. So the risk of rejection is very low. I'm not sure about you, Dr. Gorman, but in the clinic, return to function, you can, after having the procedure done, which usually takes about an hour, you can resume normal activity very quickly. For sure, ask your doctor because some vary, but I do know that it is like could be same day or next day.
I agree with that.
And
Yeah.
yeah, and then you should essentially be seeing some noticeable changes within 4 to 6 weeks after the procedure.
So, of course, with any type of procedure, there are risks, of course, risks,
Mhm.
infection. And then, you obviously they're injecting you. There could be damage to some local structures that are where they're injecting. However, just make sure you go with a physician that obviously they're all
Mhm.
very, very good. Well, most are very, very good, but that is trained in PRP injections. And I believe I do not know what's required and what's not, but doing them underneath ultrasound or fluoroscopy or something of that sort where they can actually visualize where they're injecting. Again, I'm not a physician, but to me that would be a best practice.
Yes, I think I saw that as well, that most of them are guided by an ultrasound or some type of imaging to make sure that it is given in the right spot.
Okay.
So, like we said earlier, we will not go on our tangent of insurance on this podcast, but the cost of it could be, it ranges like some is $250 to $1,500. I've seen just something to for sure ask about, but to know that this exists, see if you're a candidate, see how much it costs, and see what you can do. Um, is everybody a candidate? No. Um, there are some patients out there, if you have a low platelet count, if you have anemia or cancer, or undergoing any type of chemotherapy or immunosuppressed, you may not be a candidate, but for sure, speak with your doctor.
Yeah, and you know, I think if I had pain that I think or that I was told would respond well to this, and I'd been dealing with this pain for a while, and maybe
Mhm.
other types of treatments weren't working, I would absolutely do it. I think it feels PRP very, very, very safe. As you said earlier, you're using your own blood, so there's no risk of infection from that. But I don't know. I know it's an expense, but I tell everyone all the time, if you don't have your health, your quality of life is going to suffer on all fronts.
Mhm.
So I think we all honestly need to invest a little bit more in our health. We have no problem spending money on other
That's
things,
right.
but sometimes when it comes to our health, we're like, oh no, insurance does not pay for it. I'm not doing it. Well, anyway, I think it is an option, and that's just to kind of recap everything. We're just here to provide options and talk about different types of treatment and diagnoses that are out there. It's really it's up to you to ultimately do your own research and see what is
Mhm.
going to work best for you, and if this is something for you.
Great. So, just a little recap today before we go. The purpose of PRP is to use your body's own platelets to promote the tissue growth and healing. There are low risk factors to the procedure, but it may not be covered by insurance. And then it's just important, like Dr. Gorman said, to be educated, to be able to discuss this with your doctor.
All right. Well, we want to thank everybody for joining us today. We hope you learned a little bit about platelet rich plasma, and maybe it could be an option for you with your pain, but we hope we've educated you just a bit. Now, let's see, Lauren, next week, what do we have on the agenda?
So next week, we're going to be continuing the subject of low back pain, and we're going to be going over a joint called the sacroiliac joint, which I like to abbreviate to SIJ joint. But it's a very specific joint in the lower back that can sometimes create some problems. And we're going to go over the symptoms of it, what is the joint, a little trivia question, and what PT can do for you if that
Ooh,
is the case.
trivia.
There is a trivia question, and you have to stay tuned to the end of the episode to figure it out. And it may help you at your next trivia night. Who knows?
All right. Well, thank you, Dr. Bennett, for your time. And thank you, everyone, for joining us. And we will see you next week.
All right. Thank you. Have a great week.
Bye-bye.